Our next speaker is Dr. Navneet Agrawal, and he is a consulting diabetologist at Gwalior and a chief diabetologist and director in Obesity Thyroid Center Gwalior. He is CEO and founder of DNA Sugar Clinics. And his introduction is such a prominent and stalwart that his introduction will take a very long time, but some of the prominent awards he has received: Healthcare Excellence Award for improving affordable access to diabetes care 2022, Times of India Healthcare Icon 2017, Distinguished Diabetologist 216, Best Youth Dr. Gwalior 2016, and he has got many publications at his name. He is the editor of Annals of Diabetes and Clinical Complications. So without taking much of your time, over to Dr. Navneet Agrawal, please.
Thank you, sir. Thank you, chairpersons. Am I clearly audible?
Yes, yes.
So my screen is visible?
It is blank. It is visible, but it is blank.
Now it is, the slides are visible?
No, slides are still not visible.
They are not visible?
No.
But I have shared the slides. They're not visible?
No. Can anyone, Nishad, can you help us for the screen share by Dr. Navneet?
Are they visible now?
Yes, now they are visible. Yes.
Okay. So thank you, chairpersons. And at the outset, I would like to thank the organizing team of Diabetes Care for inviting me and giving an opportunity to discuss the democracy in diabetes. The word democracy is derived from two words. Demos means the people and kratos means the rule. So the democracy is by the people, for the people, and of the people of the country. And our constitution is committed to secure justice, liberty, and equality for the people of the country. But our constitution does not explicitly define the right to health. So though the several references has been made about the public health, and in landmark ruling, the Supreme Court has reaffirmed that every citizen has right to health. So the right to diabetes care or right to euglycemia is under this obligation and should be provided to every citizen in appropriate and affordable manner. If we see the diabetes landscape in India, we know that the occurrence of diabetes does not respect the boundaries of age, gender, socioeconomic status, geographical boundaries, or location, language, or state. So it is prevalent in all the areas. And we know that the India is home to 77 million diabetics, and almost around 200 million pre-diabetics are in waiting. And this is the usual journey of a diabetic patient. When a patient is being diagnosed as a diabetes with symptoms or even asymptomatic, he goes into the shock or the denial phase. And he follows either the Google, WhatsApp, or relatives' advice and tries to control or normalize his blood glucose with the home-based remedies without any scientific evidences. Here he misses an important opportunity of diabetes remission or reversal. And majority of the patients, because of lack of awareness, accessibility, and the accessibility to the quality diabetes care, and lack of funds or the lack of affordability, they does not take the proper treatment. And even if they consult, the adherence and the compliance to the treatment is poor, and which is an important issue and which results in a poor clinical outcome and the higher A1Cs. Around 80% of the patients, they realize their diabetic status when they cross the stage of pre-diabetes, and here they miss an important opportunity of remission. And about 70%, 75% of Indian population has unlimited access to a quality diabetes care. So there are some fundamental challenges in achieving the target A1C in Indian population, like accessibility. Almost around 95% of the people are from tier 2 cities and beyond, where only 7% of specialists like endocrinologists and diabetologists are giving their services. So this is leading to a poor patient-provider ratio. And about 70% of the people or the diabetics are unaware that this can severely affect their vital organs, and only less than 10% of the patients has met a diabetes educator in their duration of diabetes. So And affordability, it is another major challenge, as the majority of the patient has to pay from their pocket for the medicines, for the consultation, for the investigation. So sometimes the affordability is a challenge in achieving the target A1C. So the net result of this is that almost around three-fourths of the Indian population has a poor glycemic control, and of them, almost around one-third had a microvascular complications. And this is the data from ICM and India study, where around 60% of the patients has not checked their A1C in last 1 year. So what is the need of what India needs? We need to democratize the diabetes care, and we need a care program which should Sarvodaya, that is for everyone, but it should include Antyodaya, that is, it should provide benefit to a last person in the row or the weakest section of the society. And even our constitution highlights the three values: justice, equality, and liberty. But when we talk in terms of diabetes care, justice implies offering correct screening, diagnosis, and therapeutic tools to the patients who is in need. Equality implies access to diabetes care to all without discrimination on any ground. And the liberty implies the patient's autonomy and patient-centered care and liberty to choose the type of care. But the challenges are many, and the challenge is to achieve this target A1C is a poor patient-provider ratio in the country, where a burden is expected to rise due to the rapid changes in the lifestyle and demographies. So the prevalence is increasing day in, day out. Though the government has launched the National Control Program, wherein thousands of national NCT clinics, the medical officers, the doctors, and the paramedicals are providing their services. And besides this, multiple private diabetic clinics, including the corporate hospitals, individual centers, the diabetic clinics, they are providing the care. But do you think that this is sufficient in a country where half of the patients of the diabetes are undiagnosed, where the incidence of new cases is highest in country? So what is the new hope? And the hope is from, in such scenario, we can have a hope from the digital technology, wherein the digital technology based solutions in combination with the traditional physical care can be an answer to many of the challenges of the diabetes care in the country. Even globally, the Lancet Commission has mentioned a mission-oriented digital approach to the digital health, which aims to diffuse its benefit equitably, economically, and in a democratic way. So the digital transformation in health are human right based and support the universal health and health coverage and the health for all. So as globally as well as in India, we know that India is the second largest mobile phone consumer worldwide, and by using the digital technology, we can have improve in the delivery of the diabetes care, including the health promotion, prevention, primary care, and even the specialized care in India can be provided through the digital platforms. And let's see the clinical evidences. This is the data from US, where a use of AI virtual health assistant has showed that just by use of this has showed a significant reduction in A1C, and which was sustainable for 2 years. And this is the data from the real world study from the country and from the India, wherein 7,000 plus patients who were using this digital or the smartphone combined healthcare diabetes care ecosystem, and they have a significant reduction in the preprandial and postprandial blood sugars in the 45 days. And this digital technology or the digital ecosystem is not only helping in controlling the hyperglycemia, not only helping in achieving the euglycemia, but it is also helping in reducing the hypoglycemic events, because we know that when there is no fear of hypoglycemia, we can achieve the target A1C in any patient. So we always fear a hypoglycemia, as Dr. Rudy was discussing, that we should be very cautious about avoiding the hypoglycemia in the older population or in the elderly population. So we always fear a hypoglycemia. So even the digital technology or the digital ecosystem is helping to prevent hypoglycemia, and there was a significant 80% reduction in the hypoglycemic events in the patient who use this digital smartphone connected ecosystem. So though there are multiple solutions in the market, and patient can choose from anyone from them, and depending on his or her need, so he can choose like what type of the patient's profile or patient's comorbidities and patient's access to the digital technology. But there are multiple solutions available in the market. So in nutshell, and to summarize, if we see the democracy in the diabetes can be achieved through a digital transformation, which will help in expanding the geographical access to the diabetes care, which will help in increasing awareness to the patient, so they are more aware about their diabetes care. They can have a more they are more vigilant about the self care. They should know the targets of their fasting and PPG. They should know more about the dietary plan. They have a more knowledge about their nutritional intake, the carb intake, because like in India we know that the major challenges the dietary intake, and to explain them, because like we are majorly the cereal based, or the diets which we are taking in the across the country, they are all more carb based. So it will improve the awareness about the nutrition, about the exercise, about the physical activity, because we know that the lifestyle is a major pillar of managing type 2 diabetes. And these digital transformations will also help in improving the patient provider ratio, wherein they'll have less burden of the patients on the providers, wherein they can use the digital technology, EMR based solutions, the appointment based appointment systems. So this will help the providers also, and will help in reducing the patient provider ratio. It will reduce the providers burden also. And this digital technology, the use of this digital technology, we can reach to the last person in the row, or we can reach to the weakest section of the society, as we can expand the geographical access to the care. Because we know that the patients who are staying in the rural areas, patients who are staying in the far reach areas, they have to travel to the cities, they have to travel to the major towns to consult a specialist or a diabetologist, and to fetch their medicine and to get their investigation. So like by just the digital technology, we can have an access to those rural areas where the lack of services are there. We can really change the entire system of diabetes care. And finally, with this use of technology, like we are reducing the cost of transport, we are reducing the cost of waiting, we can reduce the economic burden, and ultimately at the net result of that, we can improve the clinical outcomes in our patients of country. So thank you very much. Let's join hands in serving our nation and its citizens. And thank you all for your significant contribution in making India as a diabetes care capital of the world. And this philosophy of the Gandhiji, I think, Sarvodaya through Antyodaya, which means the development of all to the welfare of the weakest section of the society, will definitely help us in guiding the diabetes care for the future in the country. Thank you very much for the patience.